Hello, I am your host, Kathy Chester, and welcome to the Move It or Lose It podcast, a podcast about all things that move the mind, body, and soul. The Move It or Lose It podcast is for information, awareness, and inspirational purposes only. I am not a doctor, and I don't even play one on TV, so please consult your doctor before making any medical decisions. The views expressed by advertisers, guests, or contributors are their opinions and not necessarily the views of the Move It or Lose It podcast. Hello, welcome to another edition of Move It or Lose It. Today, we're really excited to have Dr. Sam on, and she is most well known for her lots and lots of stuff on TikTok. And I was very excited to get to know Dr. Sam, and now even more. And we've been chatting before we even pushed record. So Dr. Sam, I'm very excited to have you on. I have become a huge fan of yours, and thank you for being here at Move It or Lose It.
Thank you. Thank you for inviting me. I think
Absolutely.
I've gotten into all the social media stuff recently and it's kind of taken off. So it's really exciting.
Yeah, for sure. It is. I just been just a fan and just watching everything till late at night last night, all of your TikTok. And it's like, yes, that was definitely a question I had. So you do a great job of explaining a lot of things and a lot of our reasons, that a lot of the questions that we all have. And so reading a little bit about you, you are an MS neuroimmunology. You are into that. That was like a word I was like, please let me get that word right. Fellow at Johns Hopkins. So explain to our listeners, what does that mean? And do you see patients?
Yeah. So basically, to become a neurologist, you have to do your 4 years of medical school, 4 years of residency, and then neurology is honestly, like most of medicine, gotten so complicated. A lot of people subspecialize nowadays, and so they do more training in a certain specialty. And so neuroimmunology is kind of the umbrella term that includes MS as well as other autoimmune neurological disorders, things like MOGAD, NMO, stiff person encephalitis. And so there are certain fellowships that are MS focused, and very few like Mayo Clinic where they have like all the other stuff. But my fellowship actually is kind of neat because I get a little of everything. Obviously, there's a lot of MS, but also I have a lot of exposure to, seeing patients with other more rare disorders. And so I do see patients. I'm typically in clinic 2 days out of the week. And the way it works is actually we, as fellows, kind of work with the attendings, like the people who are more senior in the field. And we don't, and it kind of varies out everywhere. Like everyone's not the same. It's just specifically set up where I'm training. We don't have our own personal patients, but we kind of tag along with the attendings. We kind of help, with the treatment decisions and things like that. But it really gives us an opportunity to learn from everybody. And so we work with everybody. Everyone has their own, the art of medicine. They all have their own different ways of doing things. But also there are certain people who are specialists in, like, the one person who's seeing a really rare disorder, and, then the others that are doing MS. So we kind of, I get a little bit of everything. So 2 days a week I'm in clinic, and then the rest of the time is done doing research studies. So my training is in clinical trials in MS. And so we're a very big research center and have a lot of ongoing trials. And so I'm involved in so many in various ways, but a lot of them are really as kind of a blinded examiner, which means that I don't know anything about the person, like what medicine they're on or what relapses they've had. I kind of just show up and examine them, and I document my findings. And that's kind of the way to minimize bias in kind of research.
Yeah.
So
very interesting.
Yeah.
So not busy at all.
No, not at all.
Nothing really going on in your life. So too bad. And if I believe I read, you just recently got married, right?
I did. Yeah. I got married at the end of September. So then I was out for weeks, on my honeymoon. So
congratulations.
Thank you.
Where'd you go on your honeymoon?
We went to Bali, Indonesia.
Oh, beautiful.
It was amazing. It really was.
Wow.
A long flight. I don't know if I could do that again, but it was like once in a lifetime thing. So
right.
But so I've been getting to do a lot of travel also with work. So for one of our really big studies that's ongoing called the Treat MS trial, and that's actually still enrolling, but It's nationwide, and like I get to do exams at Hopkins, but I'm also getting to travel and do exams. So I'm actually going to Montana later this week to go see
Oh, that's
patients out
awesome.
there and yeah, do exams for them. So that's kind of cool.
Yeah, that's definitely on my bucket list. I've never been to Montana and I just really want to see Montana. So that'll be really pretty.
Yeah, it was. I went in June as well to see some of the same patients, and it was just so beautiful.
Oh,
So
I bet. I
yeah.
bet it is. So that is so you've committed a big presence. I mean, when you went on TikTok, that was the big commitment. And I love that you did that. And what prompted you that decision to go? A lot of doctors I'm seeing more on YouTube and things like that, which I know a lot of times they get a lot of flack for that. A lot of times, like if I go to one of my doctors and it'll be almost like, yeah, that's not like really like medicine. Like those doctors, that's like not actual, they're not actually practicing. And I'm like, I'm pretty sure they are. And so you guys tend to get some flack for that. So what do you say to that?
I mean, I kind of went into it not ignorant of all of those things, so maybe that was for the best. I don't know, but I honestly had been thinking about it for a long time. I think that I was very fortunate to have had the medical knowledge that I had when I was diagnosed to be able to understand the literature and make a really informed decision about my care. And I feel
Mhm.
like although we try to, have those conversations, it's almost impossible to kind of cover every single thing in a clinic visit, every question.
Right.
And so, I kind of just was like, well, I was able to do that for myself, and I want to provide that for other people. And if we're having the same conversations over and over with multiple people, like why wouldn't I just record that? So even people
Yeah.
who are across the country and can't see an MS specialist might have that
Yes.
question. And they'll get that answer. And so I've been thinking about that for a while.
Yeah.
It took me a while to work up the courage
Right.
to actually
Yes.
to post the first video. But I really think that my passion's in patient care
Yeah.
and education, and coming from a family that wasn't in medicine. I mean, I know a lot of my colleagues, like some of my colleagues, they're like parents and other family members are medicine.
Mhm.
Nobody was in medicine, and my mom had a lot of health, like chronic health issues, and so it was really important to me to be able to kind of like boil things down to a simple way to explain things, like for a lay audience, and not use too much jargon. And
Right.
I think it's really important because sometimes we forget as doctors what words are not normal vocabulary for people. And people just start
Absolutely.
spouting off things and you're like, what? So I
Yes.
think it's really important to keep that in mind. And I try my best to do that.
I
But
love that. And I think that, I mean, truly, I don't see that going backwards because I think that once that opened up and through COVID and stuff, even more so, I really believe that it has given us such an ability to be able to, like you said, to be able to get information when we're not able to see our neurologist or doctor. It's like, we get maybe 10, 15 minutes with our neurologist, and it's like, I have so many questions about other things. I have so many questions about what about this? What about that?
yeah,
And, simple things that may not even be needed to be asked in a visit with a neurologist, but just curiosity. And so, like, there's things that you answer that, it's like, yeah, thank you, because I've had that question for a long time. And, same with the doctor that I really enjoy on YouTube. And it's like, to hear things like it's not practical. It's not, I don't think you're living in the same world that we're in, because this is the world that we're in, and it is social media, and it is how we're getting messages across, and it is how we're communicating now.
right.
So I love that you're doing that. And for people that don't know, you do have MS, you do have multiple sclerosis as well.
Correct.
So talk to our listeners about what was life like before diagnosis. And did you have feelings before, and how long, like something's not right with my body?
Yeah, so I was diagnosed in 2016. I was still in medical school. My first symptoms were in 2015, at a very particularly stressful point in my life, which I think is something that is common, that symptoms start to come out with a lot of stress or other, even like
Sure.
infections, some sort of stress on the body. I was initially studying for my first board exam, which is like
That we
a lot of
should.
like just sitting and studying for 8 to 10 hours a day for like weeks on
Yeah.
end. And initially I had a few kind of odd symptoms, which even thinking back, I don't know that I can even like now with my neurologist brain, like link that with MS, but it was
Right.
just so weird that like I would have almost like a visual migraine where you have like snow
Yeah.
in the visual field, and never get the headache. Again, I wasn't a migraine person. And then one day I did have a severe migraine and I finally was like, oh, I understand now what people are talking about when they have a migraine.
Right.
And that was unusual for me. And like, whatever, I didn't think anything of it. And I don't even still know if it's related, but, and then shortly thereafter, I had what I now know is a very mild optic neuritis, but so
Uh,
mild to the fact that to the point, like my visual acuity was fine. Nothing was really
uh,
blurry. Everything was just really bright in one eye.
yeah.
And I tried to explain
Wow.
that. I went to the eye doctor. I was like, I don't know how to, it's like when you come out of a dark movie theater and like into the sunlight and you're like, oh, for a second, your eyes adjust. But I was like, it's like
Right.
constantly and nothing is adjusting. I don't know what to tell you.
Right.
Did visual field assessment. They were like, everything's fine. It's like, okay, fine. So eventually that got better, as we typically hear with MS symptoms.
Right. Right.
And then I want to say it's been so long now. I think it was a few months later. I was in another like stressful rotation in medical school, which by the way,
Right.
you get to medical school itself is so super stressful. I mean, residency is stressful, but as a medical student, you're working with a new team every 2 weeks. You don't really know them. You feel completely inadequate and incompetent all of the time because there's so much to learn and it's
Right.
just so stressful. So anyway, I was in one of my rotations and one morning I woke up and felt like, for a lack of a better way to describe it, like I was drunk. Like I was like,
Yeah.
I was like, what in the world? Like it was just so
Drunk
bizarre.
without the fun of the night before.
Right. It was so disconcerting. And I was like, I don't understand what's happening. And I was well connected. So I did tell like one of my mentors, like, hey, like something doesn't feel right. I don't know. I had seen my primary and she actually did, to her credit, she ordered an MRI of the brain.
Wow.
Um,
Good.
and I
That's
got that.
rare.
Yeah, I know. Well, and I, again, so as a medical student, you're also told like medical student syndrome's a thing where you think you have everything that you're
Yeah.
studying, like learning about. And so some part of me was like, maybe I'm just being a little over
Sure.
dramatic. I don't know. Anyway, I went and got the MRI and that looked okay, actually.
Right.
And so I
Wow.
was like, okay, that's weird, but sorry, my cat almost just fell.
It's okay. I'm about to let my
um,
dog out. She's about to go
uh,
bananas.
so anyway, I ended up getting referred to a neurologist because they were like, that's kind of weird, but like maybe you should just get checked out. And so
Right.
I actually couldn't be seen at Hopkins because you have to have a diagnosis. It's very, you
Okay.
don't really have much general neurology. And so I ended up
Right.
going to a community practice. Again, by the time I went to see them, my symptoms were gone, as is typical. By the time
Right.
I got in, right, because the wait time's usually like, I don't remember how long it was, but like a month or two. By the time
Right.
I got there, it was gone, but I knew something was wrong and I hadn't had my neurology rotation yet. So I didn't know how to do a proper eye exam. But
Right.
I feel like my eyes aren't moving together. And so I was taking videos like compulsively of my eye movements because I was like, I know there's something wrong. And everyone's telling, and I went back to the eye doctor also, and they were like, yeah,
Right.
you're fine. There's nothing wrong with you. Um, and so that eventually got better. The neurologist was like, yeah, we should do a spinal tap. It's just kind of weird.
You're like, oh, good. Love
Yeah, I was like,
those.
great. Um, well, for better or worse, I actually hadn't gotten to the point in my career where I'd done any yet. So I actually didn't know what to,
Okay.
ignorance was bliss, I think.
Yeah,
but,
definitely for
but
those.
yeah. So, and then because of the eye movement issues, they did hook me up with the neuro-ophthalmology, which
Oh,
again, this
yeah.
is some specialty care that not everyone probably has access to.
Right.
Just, I was connected, I was within the system. And by the time I went to go see the neuro-ophthalmologist, which again was a wait, I showed him the videos and he was like, oh, clearly like this was an INO, a partial INO,
Uh-huh.
which is when your eyes aren't moving.
Right.
And we learn in medical school what an INO is. Like you look out and the other eye doesn't move, but that's not
Right.
the case, right? I mean, in my case, it was like when I looked, the left eye just kind of dragged behind and then it
Right.
caught up. And so, it was like a little bit disconcerting, but not totally disabling. And so I just went about my
Right.
business. And
I
so,
think we all do that. It's like,
yeah,
well, it's annoying, but I can still work with
right.
it. So
And
it's okay.
as long as I didn't look to the right or like go down the stairs to the right, it was
Right.
fine. And I was like, all right, well, that's cool.
Yeah.
Finally, eventually that went away. And the neuro-ophthalmologist was the first person that was like, I had my LP results at that point. I had one oligoclonal band, which was kind of like, 2 is positive and 0 is normal. So what does 1 mean?
Right.
Everything else looked okay. And so
Right.
it's like, maybe you want to start a medication for MS. Like maybe you should see somebody in the MS center. And I was like, maybe, but probably not. So
Yes.
I didn't want to think about it. Like I just was
Right.
like,
For
yeah,
sure.
I think a lot of people go through, there's like those stages of acceptance that like, I
Oh
just,
gosh. Yeah.
in that stage where I was like, no, this is not what's wrong with me. But I did, secretly do my research. I was reading all about
Mhm.
it. I was reading about the MS Center at Hopkins and like all the research they were doing. And I was like, wow, this is actually really fascinating stuff. And like at that point, like as things progressed, I went through my neurology rotation. And I was like, you know what? I really like this. Like this is what I think I want to do. So I took an extra year in medical school and basically did diet research with one of
Yeah.
the attendings there. And during that year, right at the beginning of that, I had another more severe optic neuritis, but that time I knew what it was.
Okay.
I walked right into their office and I was like, I'm having optic neuritis.
Yeah.
And then kind of after that, the rest is history. So then they were like, yeah, this is definitely the diagnosis. Now we,
Yeah.
repeated imaging and whatnot. And I did have some lesions, but in any event, I, was able to read about all the options and I ended up going on Copaxone. That was my first
Okay.
DNP.
Yeah. So are you still on that or no, because you said
No,
you're
no,
on
no, no.
Ocrevus now.
Yeah. So I
Yeah.
actually, now I had 3 relapses in the course of about 14 months. So
Mm.
that's pretty quick. Now they weren't
Yeah.
super severe and it wasn't anything disabling like, a cord lesion would have been, but still relatively active. And then the Copaxone seemed to have controlled it. So in all honesty, like my disease seemed like it was on the milder spectrum of things. But after a few years, I just could not do the injections anymore. I was
Yeah.
getting so much scarring. I mean, I didn't have a lot of subcutaneous fat to start with, and
Yeah.
it's all getting scarred. I had like lipoatrophy everywhere. And so um, I was like, I'm missing doses now just because it's so
Sure.
uncomfortable. And especially with residency, I would be working like 28-hour shifts. And it
Yeah.
was like, I can't do this.
Right. Right.
So at that
Yeah.
point, I switched to Vumerity or
Okay.
maximal fumarate. I know I use the brand names a lot because that's what patients know, even though
Right.
technically we're like supposed to be using the generics but anyway.
Yeah. Yeah. So very interesting. So how do you feel on Ocrevus? Have you done well with that?
Yeah, I have done well. So
Good.
then the other thing, so I was on the Vumerity for a while. I also have kind of like a rheumatoid arthritis. So I had been on a few other
Yeah.
meds.
Interesting because I have that.
Yeah, it was like
And not a lot of
seroquel.
people do with because it doesn't really go together so often. So I don't meet a lot of people who have MS and rheumatoid.
We do see a lot of overlap with rheumatologic diseases.
Really?
Yeah. Mm-hmm.
With rheumatoid and
Just
multiple sclerosis?
generally like overlaps. There's definitely, it's not the most common, but there are patients with lupus and MS, RA and
Yeah.
MS,
I know I see a lot
Sjogren's.
of the overlap, but I
Yeah.
don't see those two as
Yeah.
often. Like
Oh,
when I
yeah.
do.
It
Interesting.
happens. I wouldn't say it's like,
Yeah.
but it definitely
Yeah.
happens. And I
Because
think,
it's like your body wants that really hot shower, like the arthritis. I'm like, oh, and then the MS is like, get out. And I'm like, ah. So I'm sure you find that too. All my arthritis wants everything and warm, and all my MS is like, no. I'm like,
yeah, I don't know. Again, it's not, I never was positive for rheumatoid factor. And so it's like still a little unclear. And I've always had a little bit of questions. Even my neurologist was like, we don't even know, like, do you even have MS? And I was like, well, I don't know, like it's always a question, like, could it be something else? Like one of these other things that cause white spots in the brain?
right.
Like, well, the relapses I had were pretty classic for MS, but
Yeah.
sure. Is it possible? It's always possible that it's something else. Like,
Sure.
and so,
Yeah.
but anyway, so anyway, that aside, when I was on Vumerity, I was getting sick a lot because it was giving me
Okay.
lymphopenia, where the
Uh-huh.
lymphocyte count goes down. And that's actually something we're seeing quite commonly with that medication, more so even than like Vumerity, or I'm sorry, the Tecfidera. But
Uh-huh.
anyway, so I was getting sick and I was just like over it. I mean, I had this
Yeah.
really bad bout of hand, foot, mouth disease from my
Wow.
and it like took me out for 3 weeks. I was
Wow.
quarantined in the hospital until my hands healed over because like
Yeah.
I had open ulcers, like that's a
Right.
contamination risk. So, and then I got
Yeah.
COVID and I was just like, okay, I'm done. But also just for family planning purposes, I had been thinking about
Right.
Ocrevus. For, people with mild disease, we usually, sometimes you can get away with just going off medication. during
Right.
pregnancy. It's a relatively protective time for
Sure.
MS, but I think, and in retrospect, I may have been able to get away with it, but I was like, my livelihood kind of depends on me being able to work, and like taking care of other
Right.
people depends on me being able to work. And I really don't want to take those risks. And so
Sure.
I I'm going to be a little bit more aggressive with my own care.
Yeah,
So anyway, that's
definitely.
why I switched, and I switched earlier this year, and things have been going really well.
But that's awesome. Yeah. Whenever I say, I always, whenever I talk about Ocrevus, that I'm not doing granite, but don't stop or don't decide to not
Yeah.
take it just because of
Yeah.
one person,
Right.
because, I, there's so many people I know that are doing great on
Yeah.
Ocrevus. So
Yeah.
go for it. If that's
Yeah.
one of your, and you feel like this is could be great for you, do it. Like, don't not do it because one person isn't doing well.
Yeah.
So we all do different on, I mean, I was on Tesabri for years and I did awesome, but I had plenty of people that would be next to me getting very sick on it.
Right.
So,
Right. Exactly.
every medication is going to do different things for us.
Yeah.
So it's just, one of those weird things. But so one of the other things I wanted to talk to you about is after your diagnosis and all of that, and you decided to do a lot of different things. Um, so when did you know that you wanted to be a doctor? Did you know that you wanted to be a neurologist your whole life? Was that something really that you really wanted to do? Was that like always in you?
It's funny because I didn't remember wanting to be a doctor in like high school or earlier, but then I was talking to a friend in high school, and they were like, "Yeah, I totally remember you saying that you like were interested in that." So I was like, "Okay, maybe I was interested in that before I remember." But I was actually really interested in mental health, in
Uh-huh.
psychology. I thought the mind was just fascinating, and I
Right.
honestly thought that I would be either a psychologist, like a therapist, or a psychiatrist. And
Because when you said that, I
yeah,
laughed because
yeah,
I wanted to be a psychologist and
yeah.
I wanted to go to Michigan and do that. And my teachers, and they always laugh. They're like, absolutely not. I'm like, what? They're like, you will take the patients home with you. And they were absolutely correct because that is my personality. So, you decided not to do that. So do you think as a neurologist that because that was in you, does that have a lot to do with why you want to be on TikTok and why you want so much to do that patient care? Because that is your heart. I mean, you are
I
a
mean,
very,
probably. I definitely think so, and I'm still very much sympathetic to kind of the all of the psychiatric issues that arise in MS, and like those needs in our patients, because there is a lot of overlap between
yes,
depression, anxiety, and MS. We know that for sure.
yes.
Um, so I think having that interest and that background is helpful. Um,
Hmm.
and yeah, I think just right, wanting to be there for people, wanting to talk through things with them definitely pushed me into doing what I'm doing now.
Yeah.
And also like so when I first had that idea and I went online to try to see like what existed out there, I was just kind of shocked at like the lack of information. I saw a
Yes.
lot of patients like supporting each other and sharing information. And sometimes
Right.
I saw some misinformation that was like kind of terrifying. And so
Yes.
it's like, somebody needs to do
Yes.
something.
Yes.
So
It
I was
is
like,
terrifying.
well, I have the time right now. Like as a resident,
Yeah.
I didn't. You're working
Right.
ridiculous hours. And when I start my first real job, I probably won't have much time. I don't
Right.
know. But right now I'm like, this is a kind of a sweet spot where I have
Yeah.
a lot of time to just be learning and educating people. And so this is the time to do it.
And it's so important and it is so valuable. And it is for people to come out that have knowledge and that can help because there is a lot of false information. And when you do know more and you see it, you're like, like, no, that's
Yeah.
not. And it gets concerning because you know that there's so many of our younger newly diagnosed patients and they're going on. Of course, that's the first thing they're going to go on. And you're like, this is what they're going to know about multiple sclerosis? No. So it's so appreciated. And I love that you do that. So you talked about a lot of things. You answered the questions. I love that you like fully answered the questions. And you talked about a lot about not wanting. So the first thing, did you want to be a neurologist? No, that was your first answer. I actually thought about being a
Yeah.
psychologist.
I honestly didn't
Um,
know I didn't know neurology was an area of medicine. I mean, thankfully I
yeah,
never needed to see a neurologist. And I mean, I knew about psychiatrists and therapists, but once I got to medical school and actually went through my rotations and I was learning, I think there's a special place in my heart for people who can do psychiatric care. Like it takes
Yeah.
a special person. And I was like, a lot of the medications we use, we don't really know how they work. They
Right.
take 6 to 8 weeks and then maybe they'll help. And it was just very much like, it was too abstract for me, I think. And then
Yeah.
neurology is like an engineering network. Like, I don't
Yeah.
know, I did one of my TikTok videos to try to give an analogy as to like the electricity in your house. It's like,
Right.
everything is so meticulously done that you can tell exactly where the problem is if you really understand your neuroanatomy and how the brain,
Yeah.
spinal cord, and all the peripheral nerves work. And so like that is just kind of beautiful to me, but also
Yeah.
terrifying because I was like, oh my gosh, this is so much information. Like, how does anybody
Right.
know all of this?
Right. Right.
So, and I think a lot of people are still scared about of neurology. I mean, just in the
Yeah.
hospital, people are like, oh my gosh, there's something wrong with the brain. Please, neurologists, come help. Like they don't,
Yeah.
it's just terrifying because they're like, we don't understand.
Yeah.
But I was like, this is honestly what I've probably meant to do. So let's go.
Yeah, I love that. I
Yeah.
think it is so fascinating. And I really love when neurologists, my favorite neurologist that I had forever passed away. Gosh, times so after the pandemic, I'm like, I want to say now 7 years ago, but I love that because he never stopped learning. I mean, he was always in the next big, thing. He never wanted to stop. He was in every country, just learning, learning, learning. And he was always, just very comforting, but also, he was more aggressive than any doctor I ever, like back in the day, he was like, let's do, our version of chemo
Mhm.
because my kids were really little. And he was like, we're going to attack this the exact way it's attacking you, and we're not going to give up. And so it was so empowering with me to like, we're not giving up on this. We are going to go. And he just knew me, that was my personality, was like, let's go. And he's like, I'd like you to stop running the track until you pass out. I was like, but I'm going to fight it. Like, so he knew how to get to me. And I think that's why I kind of fell in love with you when I was watching you, because I thought that's you, because I think you will always know how to get to your patients. You'll know them because that's your personality. And so because of that, you'll know how to reach them. And that will be a big thing. I mean, 7 years later, if you meet one of his clients, they will immediately weep and say, and they would drive hours to get to him.
Yeah.
So I just see you that way.
Thank you.
Yeah, for
That's so
sure.
nice.
Well, thank you so much, Dr. Sam. This was awesome. We're going to do our part 2 and learn so much more I have so much more questions about your presence on TikTok and how people have received you and going from there and what's next for you. So looking forward to this. I can't wait for part 2. So again, thank you so much, Dr. Sam.
Thank you for inviting me.
All right, guys. So this is part 1 of our interview with Dr. Sam. And so stay tuned for part 2. Bye, guys. See you soon. Well, thank you so much for joining us today on Move It or Lose It podcast, where you can again find us every Tuesday and also wherever you like your podcast, whether it's Apple, Spotify, Stitcher. Join us on that. And we can't wait to see you again. We're going to have a lot of exciting guests and working together. And as always, you'll hear us say at the end of every podcast, we are stronger together. So let's do it. Let's become stronger together. Have a great day.